Hi, Dr. Sung here, and welcome to Thyroid Success Secrets number 5. Did your doctor ever tell you about autoimmune triggers? One of the most common questions I get is, how did I develop this autoimmune condition? Well, it's pretty much genetics or the environment. It's a matter of what came first, the chicken or the egg. We all know that genetically you may be at risk for developing certain problems or certain conditions. So if your mom had a thyroid condition, or if your grandmother had a thyroid condition, you probably will develop a thyroid condition because of genetics. Then there are environmental factors, one of the most common being chemicals. Cigarette smoke attributes 519 chemicals that can be exposed to your body. Here's a list of a few of them. Tobacco-specific N-nitrosamines are well known to be one of the most carcinogenic chemicals out there for the smokeless tobacco and the tobacco smoke. Benzene can be found in pesticides and gasoline. It is present in high levels in cigarette smoke and accounts for about half of all human exposure to this hazardous chemical. Pesticides are used in our lawns and gardens and inhaled into our lungs via cigarette smoke. Formaldehyde is a chemical used to preserve dead bodies and is responsible for some of the nose, throat, and eye irritations of smokers who experience breathing problems when they're smoking cigarettes. So chemicals in general can trigger an autoimmune response. The latest chemical that has hit the news is BPA. This is a very nasty chemical called Bisphenol A. It is used in a lot of plastics, and Bisphenol A is extremely bad for the thyroid health. It is a trigger for Hashimoto's thyroiditis or an autoimmune thyroid. Another chemical that can be found is rocket fuel. You heard it correctly, I said rocket fuel. You may ask, how am I exposed to rocket fuel? Well, studies have shown that 30 to 40% of women in America have remnants of rocket fuel in their body. It gets into the groundwater and it stays there for a very, very long time. Another trigger for autoimmune thyroid is iodine. When it comes to Hashimoto's thyroiditis, iodine supplementation is very controversial. I have seen patients in my office with exacerbations of Hashimoto's due to excess iodine supplementation. Iodine is an important mineral. This is needed for thyroid hormone production, but caution must be taken to avoid a flare-up of their condition. The best thing to do if you want to supplement with iodine is to get your iodine levels checked properly. I would also recommend a natural source for iodine, such as sea vegetables. Again, check with your physician before taking iodine if you have Hashimoto's thyroiditis. My name is Dr. Jin Sung, where clinical excellence meets excellent results.